Hello, Politifact. I'm the Wall Street Journal. Thanks for meeting me here.
No problem. Wow, I barely recognize you. I thought you would be a woodcut. And what's the deal with that Australian accent?
Well, Rupert Murdoch has made a few changes. Anyway, what I wanted to talk to you about is your recent column, Lie of the Year, the government takeover of healthcare.
Ah, yes. Of all the lies in 2010, that one was the granddaddy. Literally. My grandfather who watches Fox News says it all the time. We at Politifact concluded it is inaccurate to call the plan a government takeover because it relies largely on the existing system of health coverage provided by employers.
How portentous of you.
Huh?
What you call a lie actually boils down to differences of worldview or principles. In political debates, the facts are often legitimately in dispute.
I am not so sure about that. As Daniel Patrick Moynihan once said, everyone is entitled to their own opinion, but not their own facts.
A member of the liberal media quoting a Democrat? Color me shocked. The problem with Obamacare.
You mean the Affordable Care Act?
Whatever. The problem is that Obama's plan is a vast expansion of federal control over how U.S. healthcare is financed, and thus delivered. The regulations that you wave off are designed to convert insurers into government contractors in the business of fulfilling political demands, with enormous implications for the future of U.S. medicine. All citizens will be required to pay into this system, regardless of their individual needs or preferences. Sounds like a government takeover to us.
Nice talking points, Wall Street Journal. First, let me be clear that in selecting the government takeover as the lie of the year, Politifact is not making a judgment on whether the healthcare law is good policy. The thing is, the phrase is simply not true.
How do you figure, mate?
It is a politically motivated catchphrase used by conservatives to describe any initiative they see as an increase in government authority. Government takeover conjures a European approach where the government owns the hospitals and the doctors are public employees. But the law Congress passed, parts of which have already gone into effect, relies largely on the free market.
Oh, really?
Yes. Contrary to the claim, more people will get private health coverage. The law does not include the public option, a government-run insurance plan that would have competed with private insurers. The law sets up exchanges, where private insurers will compete to provide coverage to people who don't have it. The law gives tax credits to people who have difficulty affording insurance, so they can buy their coverage from private providers on the exchange. But here too, the approach relies on a free market with regulations, not socialized medicine.
But, remember that famous 2003 video? Barack Obama, then an Illinois state senator, declared, "I happen to be a proponent of a single-payer universal health care program." That is, Obama wished for a system of outright socialization of healthcare costs, in which the government would pay for medical treatment using tax dollars. Obamacare differs from such a system only in that ostensibly private insurance companies act as the government's middleman, collecting the taxes and paying the benefits. Why don't we call a duck a duck?
No, what you were talking about is a goose.
Duck.
Goose.
Duck.
Duck.
Goose damn.
Gotcha.